this point, I'd like to call the meeting to order. This is the meeting of the Naturopathic Medical Committee on Monday, June 3rd, 2019. It is 10:05 a.m. We are here at the Department of Consumer Affairs, 1747 North Market Boulevard, Suite 186 in Sacramento, California. Do we have any teleconference sites?
No.
Great. And so I'm going to call the roll. So I don't have a list. I think I'm just going to. I think I know everyone's names.
Okay, I'll call the roll now. Dr. Weisswasser?
Here.
Dr. Davidson?
Present.
Dr. Quinn?
Here.
Dr. Yoon?
Here.
Ms. Worrells?
Here.
Dr. Thompson?
Here.
And Dr. D'Amico?
Present.
Great, thank you. We have a quorum.
Thank you.
Is there one person you didn't call?
There is, but she's not here.
Okay.
At this point, I'd like to invite public comment for items not on the agenda.
All right.
There are none, and so at this point, we'd like to do the update for the 2020 to 2024 strategic plan. Do we have someone here to do that update, or is that coming from you, Rebecca?
Sorry, that's coming from me, and I apologize for my voice today. Lost it over the weekend. So the 2024 strategic plan update, I just wanted to give you guys some resources that are available on our website, but I know that there's some of you that are new that may not have had a chance to look at the old strategic plan or the current strategic plan. So I went ahead and, starting on page 12, included a copy of the current strategic plan. Right in back of that, you'll notice that there is the action plan, and right after the action plan, there is kind of an update outlining what we've done so far and anything that may still be left to take care of. The strategic planning session has been scheduled for Thursday, July 25th. We're not sure exactly the start time yet because it depends on how soon I can get people flight here. So I'm guessing it'll probably be between somewhere between 8:30 and 9 until 4:30 p.m.
Thank you.
Thanks.
Our next agenda item are recommendations and possible action on the legislative proposals to amend the Naturopathic Doctors Act. See where that is in our packet here. Do you have specific things you want to address with that?
Yes, so at the last meeting, you'll recall that we were thinking about making a change to the section of our statute that outlines who is allowed to approve CE for us. We were thinking about including NANCIAC, and you guys wanted a little bit more information on what the difference between NANCIAC and AANP was, and kind of to bring a little bit more information to you, so I did. You'll notice that in the packet, I've included both the AANP and the NANCIAC applications. So the big and obvious difference between the AANP and the NANCIAC is the standards. If you look, you'll notice that the standards and vetting of NANCIAC are a lot more stringent than that of the AANP, and it's not saying that the AANP is bad. The AANP is pretty good in their standards. However, ANP kind of takes that and then some. So you'll notice that the standards of excellence following requirements or minimum standards set forth in the ANP for approval of the naturopathic continuing education. Educational activities should be free from commercial bias. No company logos or names may be printed on any presentations, slides, or handouts. In other words, the content must be free from commercial mention. Though the event as a whole may be listed as a sponsored by organized by a commercial entity, presenters must be licensed healthcare professionals or experts in their fields. Educational topics must promote or should promote improvements in the quality of healthcare or the management of healthcare practices and businesses. And all speakers must complete financial disclosures and presenter compliance agreement. The NANCIAC standards are much more comprehensive. They're designed to cover everything from the development to presentation, including removing commercial bias, making sure the CE activity fills the needs of NDs, addresses practice gaps, further requiring that CE activities is evaluated by the participants, ensuring sure the learning objectives practice gap was achieved. The ANP approves CE activities. NANCIAC accredits CE providers. So NANCIAC monitors accredited providers primarily by requiring reports before and after CE activities, but also they demand the ability to attend the CE activity just so that they can make sure that they are complying. NANCIAC also requires disclosure of financial relationships to the participants. Unsure if this is required by the ANP, but I do know that the ANP does ask for this. I don't know if they actually look into it or not. So those are basically the differences. The ANP, again, does the actual courses where the NANCIAC is doing the providers, and they do it for a 5-year period. And the whole entire period that they have approved them for, they're going and taking a look at it intermittently, so they're not going 5 years without being looked at. And those reports are initiated and have to be submitted to NANCIAC every time a CE course is provided. So that's kind of what I brought here for you guys today, so that you can see exactly what it is that they do, kind of what their vetting process is, and if you guys have any questions, I'll be free to answer them if I know them.
And with this oversight, does that include Canadian CE as something that we would be able to take advantage of because it's North American?
Yes, so if they, if a Canadian provider gets vetted through the NANCIAC, then yes, absolutely, it would be something you guys could take.
Great.
Excuse me.
Yes.
Hi.
Hi.
Actually, I had a couple of questions about the strategic plan update, but we kind of zoomed on ahead.
Sure.
So I'm not sure at what point it would be appropriate for me to do that. I want to interrupt the flow here first.
No problem.
Yeah.
Well, if there's any other questions on NANCIAC, I'll go ahead and answer them, and then we'll just shoot right
Yeah.
back over to yours.
Great. Okay, thanks.
I have a question. Sure. This seems to be a point of continuing confusion at every conference that I go to. And the scenario is that a person is presenting something, and they have no commercial affiliation with anybody. They're just a practitioner or scientist or pharmacist or whatever. But they say that X works every time in this situation, or this is a great medication to consider. And it may be a drug or it may be a supplement. And they get very confused about whether or not they can say what the name of that is. And now, clearly, it's not a question when it's a drug. People can say that, and that's a commercial interest, in a sense that they're supporting the drug. But then when it comes to the supplement, they'll sometimes list all the ingredients but not actually say the name. And I just wondered if you have any clarity from NANCIAC's point of view on that.
So in our own conflict of interest laws and our own statutes, it does say that the commercial biases can't be there. So I know that there's certain drugs, like if you're talking about heart disease, I'm sure that there's some certain medications that are better for heart disease than others. And whereas you're probably not going to want to put that pharmaceutical manufacturer out there, you could say, these types, and you can use the unbranded names, are good for, but I would really strongly try to stay away from the commercial bias, because then it is actually violating our conflict of interest laws for CE.
So just to be clear, any mention of the name of any supplement, no matter how unique and specific it might be, would be considered a commercial bias. Like if I said Nature Throid versus Armor, for example, that would be considered commercial bias?
It would be, yeah. So in that particular instance, the person can say, hey, if you want to come and see me offline, I can give you some recommendations. But yeah, during the actual CE event, they probably shouldn't use those branded names because then you're kind of on that fine line of violations.
And I just wanted to otherwise say that as a principle for the committee, anything that puts us more on a national or even North American standard versus individual states, it relieves confusion and streamlines a process for us inevitably going forward. So I really support that, the movement in that direction.
Yeah, I really think that it's a great program that the FNMRA has put together for all of the states and the Canadian territory. So my recommendation on this would be absolutely to accept them as an approver, but this is definitely something that it falls on the committee, and you guys can make a determination whether you want to try to get them to be added to our statute.
And are they fully functioning and operational? I mean, I haven't heard about them before. So
They are.
they have classes which are approved, they're functional. So if we add them, it's going to go into effect right away?
Yep. They are fully functional right now.
And is that something we can vote on today?
We can vote on it today. We would still have to find an author that would do a bill for us.
So it's something that we need to do as a bill rather than in regulation?
Yeah, there's no way to.
Annoying.
Yeah, it is a little annoying. I wish there was a way that we could put it in regulations, but we would actually have to name them in statute. Yeah, and it would be quicker in statute anyway.
All right. Are there other questions about the continuing education, Nancy-Ak?
Yes.
I have a question.
Yeah.
Thanks. So just to be clear, are there two courses of action that we're considering at this point in time with regard to NANSIAC? One is for the committee to sort of approve using their certification, and then at a sort of a higher level to, in addition, find a way of adding to the statute in the legislation to name them as an approving authority?
So there'll only be one action. The action is to change statute to allow them to be an approver, the same way that the Chiro board is and the pharmaceutical board is. That would be the only thing at this point. However, we as the committee, I can take and look at things that are coming from them right now, but it would have to be every single provider and course that they do. It would just be one of those one-off things.
I have,
So,
go ahead, sorry.
I'm sorry, sorry, I just don't remember, I guess. Is there currently an approval authority that is named?
Yes, there's several. We are one of them, of course. We have.
The committee is one of
The
them.
committee is one of them, yes. We also have Board of Pharmacy. Anything that the Board of Pharmacy approves, we are allowed to take. Anything that an MD or a DO, so a physician and surgeon takes, the naturopathic doctors are allowed to take those courses as well. And
Board of Chiropractic.
Board of Chiropractic examiners is also an approver.
Okay, so all of, I'm sorry?
NAANP, sorry, NAANP is also
Yeah.
an approver.
And
CNDA.
what was the last one?
CNDA, that's the professional association.
State Association.
Okay.
And the National
Right,
Order.
okay. AANP is the National
Is the
Association.
National
right, right.
Association,
So,
yes.
so there's the National Association, the State Association, and then there are the other boards that are part of the government of California, right?
Sure, the
governance
two
structure, right,
boards,
yeah.
correct.
And so this would be to, in addition to those, to add the NANSIAC.
Correct,
right?
yes.
Great, thanks.
Yes.
That's what I wanted to.
And just for clarification and maybe to rehash what we had went through last time, NANSIAC has based their conflict of interest standards on California because we have the strictest conflict of interest standards. Great.
So I
thanks.
have two things. One is a follow-up on my previous question, because I'm just playing this out in my mind. If regarding the commercial bias, in a conference, when you have 300 people in the audience and they all have to come forward to the speaker during a 5-minute change between speakers to find out what the product was they were actually talking about, could they put that on a piece of paper and hand it out after the presentation?
Yeah, I don't know, and I probably wouldn't want to say, because that is,
Yeah.
it almost is kind of skirting the law there. If we approve somebody, we're going to basically tell them to not have any commercial bias, and if they don't, then they probably won't be a provider
Just a little
again.
messy thing we
But
have to
it
deal
is-
with.
It
Yeah.
is kind of a messy thing. So, yeah, after the fact, if they want to give you a recommendation, that's great, but during, I absolutely
The
would
other
not.
question that I had was, in our consideration on this question, I was wondering if you know how this plays out long-term in other professions, for example, in that, if there's a difference in that it actually costs more to become a CE provider with the Federation, even though you get a 5-year whatever you want to do. But I would imagine it's going to encourage the creation of professional CE providers that do this as their business versus kind of how we have it now, where we sometimes have individuals or very small groups that put together a specific presentation on a specific subject. Maybe they just do Lyme disease, or they just do this or that. And so it's a little bit more of a mom and pop shop potentially scenario currently, and I could see that maybe this is going to move this in a more, I don't know if you would say commercial, but more of a larger company that's going to do this. And I just wondered if you've seen how this plays out in other professions.
So, yes, with the Osteopathic Medical Board, of course, they have very large providers and approvers. So, I don't think it's going to take the mom and pops out of the business, because they can still come to us. If they're doing something specifically for California, they're going to come to California and say, hey, can you approve this for us? And we still, as the committee, have the power to say yay or nay, whether, we want to vet them or not. So I don't think it's going to take them out of there. It may even make it easier for them, because they're just doing it one time, and they're not trying to do this paperwork over and over for every single state that they're going and providing this course in. So I don't think it's going to hinder the CE providers. I think it's going to make it a little bit easier for them, but I don't think that it's going to limit the mom and pops. Absolutely not.
And so what we're proposing is allowing NANCIAC to become a certifier, but not necessarily removing that from CNDA or AND.
Oh, no, absolutely not. We're not taking anybody off. We are just adding. So we're just broadening that gap and allowing it to be another prover.
Any other questions about that? I wanted to go back to Dr. Davidson's question regarding the strategic plan, which starts on page 12 of our meeting materials.
Yeah, can we go ahead and close out this item with a motion first, so we can direct the executive
I thought
officer?
there were other items that we were going to motion at the same time.
No, we'll take them each separately.
Okay, great, thanks. Would anyone like to?
I move that we pursue allowing NANCIAC to become a CE certifier for the state of California and pursue that through legislation.
Second.
Any other additional discussion before we take a vote? Or comments?
I can call it if you want to save your voice.
Thanks. I'll go ahead and get it. All right, Dr. Weiswasser.
Yay.
Okay. Dr. Davidson.
Yay.
Thank you. Dr. Quinn.
Yay.
Dr. Yoon.
Yay.
Thank you. Ms. Worrells.
Yay.
Dr. Thompson.
Aye.
Thank you. Singleton.
Aye.
Thank you. And Dr. D'Amico.
Aye.
Perfect. Thank you so much.
Yeah.
Wonderful. At this time, if we could go back to the questions regarding the strategic plan, which is on page 12 of our meeting materials. Dr. Davidson, you had some questions?
Thank you, yes. Thank you. So first of all, I was just curious to clarify starting on page 50, the strategic plan, action plan updates. Those are updates as of what date?
So those are updates as of, I want to say, this was early 2018. These were the updates.
Oh, okay, so more than a year ago.
Yes.
Okay. And so would we want to see more recent updates if there were changes
So
to be considered?
I took a look at this, and for the most part, this is pretty accurate. There hasn't been anything else outside of this that have been completed 100%. So if it is still kind of outdated or highlighted in this, it's still right in the middle or partially being done, pending.
Okay, so in other words, everything that's still outstanding, that was still outstanding then is still outstanding now?
That is correct.
Okay.
There's not very much outstanding.
Okay. Well, the highlighted items, right, is that what you're saying, are the ones that are still outstanding,
That is correct.
right? Okay, thank you very much. And then, as part of are we going to talk any more about the process, or was this the agenda item to talk about the strategic planning process as well?
So all I was doing was giving you guys some resource material and giving you an update on the strategic plan session date.
Okay.
So it was just an update.
In past meetings, we had someone from that group, right, who talked about
Correct.
it a little bit. So I actually had a question about the process, because in the interim, since the last meeting, we received a survey,
Yes.
right? And I guess I would like to just comment and ask, so as part of my attempt to respond to the survey, I interacted with you and requested some of the data that was available about the performance metrics. And I have to say, frankly, I found it rather difficult to answer the questions based upon that data. So will there be an opportunity as part of the process to think more deeply about the data that's being collected and how it relates to the metrics that we may be interested in evaluating ourselves by?
There is. So basically, that survey was just to get a feel for your guys' interaction with the committee. We do realize that there are several new participants on the committee, so no worries. If there were things that you couldn't answer, it was just because you're too new and you just haven't had that interaction yet. So basically, it was just kind of gathering some of that foremost and upfront information. However, when we get there, we're going to have a lot more information. We're also going to have the data that was collected from the stakeholders. So we're going to see what the consumers, we're going to see what licensees and students at Bastyr are saying about their interactions with the committee, whether there are things that we can improve upon. And we take that from a large data set. And so from my understanding, there was roughly around 200 responses. So we should have a pretty decent data set to kind of start on. And then it's up to you guys as the committee to determine kind of the direction that you want to go. You can take the information from this current, and you can also go and take a look at past. I think there was only one past strategic plan other than this current one that we're on now, that you can take a look at and see kind of where we were, where we are now, and where you guys are wanting to move forward to.
Okay, so I'd like to ask a couple of follow-up questions, if I
Sure.
could. So in addition to the survey we received, there was some sort of a similar survey that was sent out to these other 200 stakeholders.
Well, a lot more than that, but I think that's what we got in response.
Okay. And was that a different survey, or was that the same survey?
It was a different survey, yes. It was kind of based on consumer licensee, so it was a little bit different than what your guys'
Uh-huh.
strategic.
And so our colleagues in the Solid office are the ones who design the surveys
That is
based upon their
correct.
expertise?
Yes.
Okay. And I asked you this actually before the meeting started, but at the end of the last meeting, there was a list of stakeholders that we were going to have a chance to look at. So basically, whatever that list is what was used, right?
Yes,
And-
that is
And so
correct.
there is some sort of a list of all those folks that got that survey,
Mm-hmm.
or some survey, and then some subset of them answered it.
That is correct,
basically.
yes.
Okay. And so from our other conversation earlier today, you're going to go ahead and offer us the
Yes,
list
I
of
will get you
stakeholders?
guys a list of stakeholders. I can kind of briefly go down the stakeholder list right now. CNDA is a big stakeholder, AANP is a stakeholder at a national level. FNMRA is always very interested in what we're doing as well, and they are also a national level federation. So it's the Federation for Naturopathic Regulatory Authorities.
FRRA,
FNMRA, it's the
FN.
Federation of Naturopathic
okay.
Medicine Regulatory Authorities. And then we also have Bastyr, who is very interested in, because a lot of their graduates stay here in California and practice. And then we have some interested parties that go onto our website, and they will also register as a interested party, and they get these types of things as well. And those could be anybody from an assemblyman to just a concerned citizen.
I just want to say, Dr. Davidson, that Dr. Thompson and I were new. We came in right before, like a few days before the last strategic plan.
Yeah.
And I am so grateful that we had that early in, when we first came in, because it's the one time, and really the only time, we could all roll up our sleeves, we get the complete big picture of everything. They take us through everything in detail, step by step, and we get the big picture, and we can talk freely about all of the issues, all of the concerns that everybody has, the big general direction, and it's really a relief because you're able to get that big picture that is so hard to get in the context of a single meeting or even a series of meetings. So I think that you're going to feel very satisfied and happy after having gone through the next plan, that everybody gets to be a member of the team, and we all get to kind of form the vision for the future and have a path to follow that we can compare our actions to and evaluate our progress as we go forward. Also looking at the bigger context legislatively, culturally, everything. So I think, just to give you some assurance, I think you're going to feel good about that meeting. I felt really great about it. I don't know if Dr. Thompson has any comments.
Yeah, and just to clarify for anyone who is not clear on this, the meeting on the 25th is only the strategic plan. It is not a standard committee meeting. It is, the entire day is devoted to the strategic plan, and we will have people, are they from Solid?
Yes.
Yeah, people from Solid here with us the entire day going through it. So it's very detailed and comprehensive.
That's great, that's great. That's very reassuring. I really appreciate that. Yeah, thank you for specifying that.
No worries.
The stakeholders. So if I had signed up on the website as an interested party, then I would have received a different kind of a survey as well?
Yes, probably, yeah.
Okay. Are we allowed to do that?
You can, but it's already been closed, so there's but for the future,
I mean-
absolutely, absolutely.
Okay, so that may be a secondary issue. All right. So I guess those are the main questions that I had. Thank you very much.
You're very welcome, thank you.
Are there any further questions about the strategic plan or the upcoming strategic plan meeting?
Yes, I would like to add something. Just looking at Section 2.4, it has in quotes the naturopath title protection as proposed language to change statute.
I'm
Can
sorry,
you
which page?
specify what page that's on?
I'm sorry, 34. So just because it's been incredibly drilled in me that we are naturopathic doctors in the state, the phrase naturopath title protection to me is a kind of a misleading.
So, unfortunately, we had Solid assisting with this, and this is just the action plan, so it was more for staff, it's more of an internal thing. So, yeah, it should have been naturopathic, but I think they were just for space, and
Okay.
But you will get your opportunity in that planning session to do.
Perfect.
to make sure that everything's spelled out.
Everything. every single word you get to approve, and then you will see their draft again and possibly again until you guys actually adopt it.
Perfect. Thank you so much.
So, I'm sorry, actually, I'm going to throw in one more question in this context. So perhaps this, you can certainly tell me that this is something that we'll talk about during that full-day session on the strategic plan. But one of the things that I was thinking a lot about when I was looking at not the survey, but the actual data that's available about the timeframes for response and sort of the publicly available performance metrics, is that, 'cause my background is in using data for improvement. And there are ways in which I would like to look at the data that we have, which are different from the ways that it's presented now. So is that part of what we can discuss during the strategic planning session, or?
Actually, if, offline, if you'd let me know what it is that you're trying to look for, what I can do is check with DCA's data governance and see if it's something that they can extract from our database. And if it's something they can extract, I will give you as much data as you want, and you can do whatever you want with it. You should have never told me that you were a data guy, so I'll send it all your way. But yeah, no, if there's something specific that you're looking for that is not currently measured in the performance measures that is online, let me know, and if it's something that DCA can actually extract, I can send you data files all day.
Okay, that's great. And then, so it may be about the data, but it's also about how it's portrayed.
Sure.
In terms of sort of,
that
bar
has.
graphs, line graphs, tables of numbers, those kinds of things.
That's
yeah.
been a little bit of my pet peeve for a while, is I don't always think that the data that they're providing is giving that full value to us. It's not giving that full, I guess, the portrait of what we're really doing. So it is a little frustrating sometimes when we know that the data's in there, that somehow we can get it, we just don't have access to it. So if you can tell me, being a data person, tell me exactly what it is that you're wanting to see, yeah, I can get with our Breeze people, and I'm sure they can make it happen.
Great.
Yeah.
I hope that will be that will be helpful, and I would certainly be happy to do that.
Absolutely.
Thank you. Okay.
I really appreciate that you bring that background to the committee. I think it'll really help us moving forward. So we're looking forward to whatever you're able to do. Thank you.
Thank you.
All right, at this point, we're going to go back to the items for our legislative agenda, starting on page 54. Yeah, exactly, scope expansion.
And so behind tab 4, starting on page 54, I know that we have scope expansion stuff. There's nothing related to scope expansion in here. However, we can definitely still have the discussion. And because there is possible action discussion, if there's something you guys want to take action on, we can definitely do it.
So, I'm sorry, I was a little confused by that statement.
It was part of the agenda. However, I didn't include anything because I wasn't sure if there was anything that you still wanted to discuss about.
So after that is a
Going
bunch
after
of
title
Nancy-Act stuff. So I
protection.
think that's just, we need to move tab 4 behind all that, right? I have like the application forms after that for the ANP and Nancy-Act.
Well, tab 4 incorporated both the continuing education and then the possible legislative proposal and scope expansion. They're both under tab
Correct.
4, I think is.
Gotcha.
So, and I think what Rebecca's saying is she only put the continuing education
Yes.
stuff in. So the areas of scope expansion that we had looked at previously had been areas of title protection, areas of, prescription rights, areas of nurse supervision. Are there any that I'm forgetting?
Yeah, but that whole thing needs to be redone. The whole thing needs to be redone on that, yeah.
And so with the continuing education, that's something that has to go into a bill, and I think the question becomes, do we want to put anything else in with it?
So at the last meeting, if you'll remember, we did discuss the title protection. There was a motion and an action to go ahead and try to find an author to take that for us. So we are still working on that. I haven't forgot about that because that is a big thing to me. If we can get title protection, it would make my job 100% easier, and it would make Raquel's job 100% easier. So that is definitely something that we're looking for right now.
And would the would the title protection and the continuing education, would those be able to be authored together, or would they need to be separate?
They could be. We could even see if the author would do two separate bills. What we don't want is, because title protection may be a little contentious, we don't want something as easy as Nancy Act to be delayed because of a title protection issue. So
Right.
when we do move forward with bills, and we try to be respectful and kind of deliberate in what we're putting together, just because if there is something that may have a lot of contention, we want to put it kind of by itself or with other contentious things that can just kind of move up and we can discuss it and hash it out all at once. Things like this that are easy, like retirement and, making changes to a status of a license and like Nancy Act, we want to go ahead and do that just kind of on its own.
Can you speak to the timeline of the work of the subcommittees regarding potential legislation in our current cycle, et cetera?
So we're going to be going to subcommittee tabs in a few minutes, so we can definitely go over that and come up with timelines.
I'm just wondering if we might have more recommendations for potential amendments after we talk about the subcommittee stuff.
We probably will.
So maybe we should come back to this tab.
Although I don't believe any of the subcommittees are ready for recommendations at this time.
So we can just put this in on every agenda until
Yep.
we're ready.
Yep, absolutely. Yep.
Right, so you're going to hear from today there's just going to be updates from each committee. Once they do actual solid recommendations, then at another meeting, you're going to hear actual recommendations that are very specific from each subcommittee. And then at that time, you can approve those and then ask that, and you can direct the executive officer to pursue those changes.
Would we need to have two separate authors for each of these bills, for NANCIAC and then the regulatory updates?
We don't have to. Hill has taken several of our bills before and have had separate ones at the same time.
And
I'm sorry, with regard to the topic of scope expansion, finding someone to carry legislation for scope expansion, do I understand correctly that we're talking about the NANCIAC, adding NANCIAC as part of the scope expansion concept, or no?
No.
That's a separate thing?
That's totally separate, yes.
And so we're talking about having someone carry that?
Yes,
separately.
And then
separately.
we're also talking about thinking ahead to scope expansion legislation that probably will include recommendations from the subcommittees
Correct.
Yes.
in some fashion.
That
right?
is
Yes,
correct.
as well, okay. And then in that regard, did I understand correctly that you said you were still thinking about who might be a good person to approach to carry the legislation?
Yes, so we're still kind of looking and vetting out who would be more appropriate to go to for the NANCIAC and for title protection, both.
Right, and they may or may not be
I'm thinking NANCIAC, but
they may or may not be the same person.
they may or may not be the same person,
Is
correct?
that what that last comment was about?
That
Will,
is correct.
does it have to be a different person or not? kind of?
It does not
It doesn't
have to be, but it could be, yes.
So after the last meeting, I found an article about how the nurse practitioners were trying to have someone carry legislation, and I guess Assemblyman Wood had tried to carry legislation to help them expand their role. But as I recall, that was not successful. Do we have an update about that?
So
Is that
was
relevant?
that the prior, because I know that they're currently working on a scope expansion now, and I'm not sure who is
Oh.
authoring that. I know that they've tried to do it in the past.
Yeah.
Was unsuccessful, so this may just be, I mean, they're kind of like us. They have tried the scope expansion a couple times. Right now, I think the reason that scope expansion is so big and I think maybe more receptive to some of the assemblymen and senators is because I think the governor is looking at getting scope expanded for some of the more advanced practitioners to help close that gap of primary care practitioners not being available for consumers. So that, because of the atmosphere right now with that, I think that's why everybody's trying to jump on board. And if they have a scope expansion want and ask, that they're asking right now. So that's why we are wanting to ask right now as well.
So we would be seen by members of the legislature as part of that larger effort by other
Absolutely.
practitioners as well.
Sure, sure. And I know there's a workforce right now, so I'm actually trying to find out who is heading the workforce so that we can actually start some communication and dialogue with them and see about maybe even getting in on that, because sometimes an author will add a whole section for another profession in their bill. So if we can do that, that would be great. But you know, it's never promised, but we'll definitely be working in that in the next couple of weeks.
Thank you.
You're welcome.
I just want to make a comment. There's definitely like a tier here. Something like approving the provider, for our CE credits is not going to be something that's very difficult, well, as difficult. And then something like title protection would be a little more difficult, where we could get some opposition. And then when we go into scope expansion, now you could have people coming out of all sorts of professions and areas to challenge that they wouldn't expect. So I think that's part of it, and why you're saying separate them all, so
Right.
that they don't tie each other up.
Correct. Yep. Because we've seen in our sunset bill, they tried to put the, I know a couple of you remember this, but in our 796 bill, which was our sunset bill, they tried to put the title protection in there, and, I mean, it was contentious. We were at the Capitol, and, I mean, there was person after person coming in like, nope. So because of that aspect, Hill went ahead and removed it so that we weren't, sunsetted because our bill wasn't going to pass. So, we do have to be strategic about this, and that's why I said if there's anything that may even be contentious, we'll always have that in a separate bill from something that's just an easy change.
I have a question. As a new member, I'm a little hesitant to ask such basic questions for the rest of them.
No.
Title
Is your
protection-
microphone on?
Is it on? No. I'm sorry.
Yeah.
Title protection.
Uh-huh.
Can you define that for me?
So title protection, currently in everybody's scope, whether you're a physician or a nurse, there are titles that you have to use. For an MD, you have to have an MD behind your name. You can use medical doctor, physician and surgeon, whatever. With naturopathic doctors, they are allowed to use naturopathic doctor, naturopathic medical doctor, NMD, ND. However, in our scope, and we're not sure why they did this, but in our scope, we have naturopaths in California and in other states that are not licensable. They have not went to an accredited school. They are naturopaths, what we consider a traditional naturopath. They haven't learned the additional medical stuff that they need in order to be a full-fledged licensed naturopathic doctor in any of the states that license. So the term naturopath, traditional naturopath, and naturopathic practitioner, which irritates me, is allowed to be used by unlicensed people. And so what's happening is a lot of consumers are going and seeing a naturopathic practitioner who is not licensed. They don't know that this person is not licensed, and they think that they're seeing a licensed doctor. So they're stopping chemotherapies. It's a gamut of things that are hurting the consumers and harmful. And because of this confusion, we want those terms removed and protected within our statute. So that's kind of what we're going for, and it was not a silly question at all. I'm very glad, and I wish more people would ask it so that we could educate. But this is the reason that we're asking for especially with practitioner, because if you ask a layperson, a practitioner is a licensee, and that's basically what, any consumer that doesn't know any better would think that they were seeing a licensed individual.
Thank you for that.
You're very welcome.
I'd like to make a comment about that, too. This issue's been a major issue for naturopathic doctors in California all the way back when we were trying to get our bill passed, the major opposition was coming from unlicensable nature paths were the big opposition to our bill. And it came to a couple heads in some committees and things but finally, we got the bill passed, but only by giving up these terms so that folks could continue to use those terms and do what they were doing before. But the problem is a lot of people will slip into medical practice, diagnosing, treating disease, giving medicines for a disease, physical exam, laboratory testing. And this is also something that's happening under a number of other banners in our state, which I won't mention them all. But there's a lot of that going on. And we got hit with it pretty early. I think the medical doctors are starting to bump into that a little bit with like functional medicine. There's a lot of functional medicine people that are practicing a lot like doctors. So this conflict is old and it seems to get in the way of a lot of our function, as well as our disciplinary actions against people in the public or our doctors. Almost all of our disciplinary actions are against folks who are not licensed by us but are using our term of
Correct.
practice. Yeah.
86%. 86% of our enforcement is unlicensed activity
And therefore our budget as well.
in our budget, yeah.
So we're spending a lot of the state's money on this, and it's a danger to the consumer.
California is also one of the only regulatory states for naturopathic medicine that does not allow their licensees to be called a naturopathic physician. In other states, they're known as naturopathic physicians. Here, they have to be a naturopathic doctor because the CMA fought very, very hard on that. So it is what it is. And for now, we are very okay with the naturopathic doctor title, but we do want to make sure that that practitioner piece, especially, and maybe even naturopath, is taken out of the marketplace.
Regarding the author of the bill, remind me whether we have a preference for someone who's the assembly?
We would definitely have a preference on the assembly side. We have always had, in the past, knock on wood, we've always had some good luck in getting out of the Senate side. We've never had an issue. It's the assembly side that we have more of the issues with. Even last time, though, we got out of the assembly side, we got held up in fiscal. So they started asking policy questions in fiscal, and they're allowed to. They normally don't, but they can ask policy questions until the time that that bill passes. So it passed both the Senate and the assembly side, and then when it went over to the fiscal committee, it didn't pass. So, and that was the 538 bill, and it was big. It was very big for CNDA and the committee both. It was a tough loss. And so CNDA has extensive knowledge and kind of experience on some of those scope expansion bills, kind of what we dealt with in terms of opposition. We can always go back to that bill and pull all of our opposition to see maybe where we're going to see it coming from this time. And we're going to want to start going and having some dialogue with these people before we go and take this bill in front of the building. So that's kind of, I think, more of the strategic plan that we have moving forward this time, and kind of taking the education and experience and demonstrating what your scope is compared to some of the more advanced practitioners, instead of doing the comparison with physicians, I think is going to benefit us more this time moving forward. Again, we're not trying to take a physician's spot. We're trying to be a primary care practitioner the way that you guys are. And so in doing so, I think we really need to show that, hey, look, you have more, as much or more than a nurse, but your guys' scope is so much more restricted than that of an advanced practicing nurse. So I think those are kind of some of the things that we want to make changes to this time moving forward. But it is going to take a while, so this isn't an overnight thing. And I know Mina has a lot of experience on this, too.
Well, I think 2 meetings ago, I think in the fall, you had also mentioned that we're limited funds for a lobbyist. And
Yes.
so my question is more, how are we trying to find an author? Because that is also requiring a lot of knocking on doors.
It does, it does. From my understanding, CNDA has found a new lobbyist, but we, as the committee, have a little bit of help with DCA. DCA's legislative staff know the people that are over at the building, so they can kind of give us some recommendations as well. And it is going to probably take me going down to the building and knocking on some doors, members coming in and doing that along with me, sending letters, and just educating. But we don't want to start going and knocking on too many doors until we really have our stuff ready to go. We don't want to seem unprepared. And I think just kind of having all those ducks in a row, having those dialogues with the people that were opposing it, in the past, and even with maybe the medical board, osteopathic, nursing board. And I know that there are some other things that we're wanting to do in the scope expansion bill that would require the nursing board opening up their act as well in order to be able to take orders from a naturopathic doctor. So there are a couple of things that we are definitely moving forward and wanting to go with. But yeah, you're right. Finances is a big thing budget-wise.
Just a comment as well, as I have been to Senator Hill's office many times in San Mateo especially, so if there's any visit that you would like, I'm open to that as well.
Perfect, that's always great. Thank you.
Speaking of our dear colleagues, the nurses, I feel a sense of urgency for the people of California, for our profession, for the patients, to have the ability of naturopathic doctors to give orders to nurses. And for the new members, this can take the form of sometimes even we will have patients who have in-home care providers, or they're at an assisted living facility and they need to take a certain supplement at a certain time, or just have help in performing a lab test of some kind, and the nurses can't do it because we're naturopathic doctors. And this really gets in the way of being able to provide their care. The nurses would love to do that for us very, very much, as far as every feedback that we've ever gotten. And some of the members in the legislature who have routinely voted against any scope expansion of anywhere have been very positive about this particular point. And my question is, if the nurses are actually pursuing yet another author at the moment, do they need to modify their act, and we need to modify our act in order for this to happen?
We wouldn't have to make any change to our act. You guys may have to do some regulations, just so that there's something in black and white on how you guys should be giving those orders, but I don't even know if you would really need to do that. We would not need to change our act. It is their act that would need to be changed.
And is this being considered with their current languaging, their pursuing of an author, et cetera?
I don't know. I'm not even sure so I know that if they're going for a scope expansion, it would probably be beneficial to have the naturopathic doctor order issue be done at the same time, but I'm not sure if they are willing to combine both of those, because they may have some contention with the naturopathic doctors giving them orders. It just depends. So I will start some dialogue with
That would be great.
the
And
nursing
there's a
board.
sticky area here in that nurses have a scope of practice wider in some cases than naturopathic doctors in terms of what they are maybe able to do in an emergency situation. I think, I'm not sure if this is true, this should be checked. But this is partly the problem now, is that if the nurse were to do something that they've been trained to do, for example, in an office where an emergency situation happened, and what that thing is exceeded the scope of what a naturopathic doctor can currently do, they're now out of their own enforcement realm, and they can get in trouble.
That is correct. And that's why it's really difficult for a nurse to work in the same office with an ND, even working at a capacity as a naturopathic assistant, although I don't know why any nurse would want to just go and be an NA. But if they did, and let's say something happens and they have to work within their nursing scope, more advanced than that of a naturopathic assistant, they can absolutely get in trouble. They really are putting their license on the line by being in a maybe predicament where they would have to lower their scope. You know what I'm saying? So if they're working as a naturopathic assistant and, God forbid something happens and their, patient starts going into a cardiac arrest or something, and they have to give them some kind of medication that maybe an NA wouldn't be able to do.
That's just
Then-
if they're working as an NA, but if we
Right.
have the ability to give orders to nurses, that's going to be a very different situation.
Absolutely.
Yeah.
Then it just depends on what their scope says and how that language is going to be kind of written up.
I would really love it, much as we're doing with everything else in kind of a modular fashion, if we have a very good dialogue with the nursing board and we have this laid out and ready to go, that we've addressed all the issues, all the things that could potentially come up, whether or not it happens this decade, doing that work will be useful. And having it ready to go so that as the legislative climate continues to change, we have already gone through these motions. So I really do hope and encourage us to have a good, open and continuing dialogue, continue to keep this present on their radar screen. And then on a separate note, my understanding is that licensed vocational nurses fall under a different board,
They do, yes.
and we may want to do the same thing with them. That even in itself would be very useful for these situations where, like in care homes or in people who are receiving care in the home. Often it's an LVN that's doing that, not a full-fledged nurse. And even that would be a really great step forward in being able to care for patients effectively and not having to double up or triple up on the number of doctors a person needs to get their care.
So, and then to answer that question, yes, so we would have to talk to the vocational nurse board separate from the BRN, but we would also like to start conversations with their associations, because that's where that scope expansion stuff usually comes from, not the committee. We are very different in that we are trying to get a scope expansion for the benefit of the consumer, not so much for the licensee. Although we love the NDs and we, want you guys to be able to practice as trained, the reason that we're pushing for the scope is because we have consumers calling constantly, why can't our ND here in California do what our ND in Oregon does? And it's, it's sad to say, hey, yeah, they took the exact same exam, national exam. They probably went to the same school, yet their scope is this and Oregon's scope is this. So it's frustrating for the consumers, frustrating for us, and I know it's frustrating for our licensees. So, yeah, we'll want to start having conversations with their associations, though.
I just had 2 points of clarification before we move on from this. The first is that I think the scope expansion bill that Rebecca referred to earlier was not an RN expansion bill, but a nurse practitioner expansion bill. Is that correct?
That is correct, yes.
So that would be, when you were saying, if they're moving forward with scope expansion, I think we are talking about 2 different boards there,
Yeah.
although I completely agree with your point. And then the other, just to make sure that everyone's clear on this, that naturopathic medical assistants can administer intramuscular and sub-Q injections, and there is no prohibition from them giving oxygen or giving epinephrine in an emergency. And we should never have a naturopathic medical assistant who's afraid to do that if they're appropriately trained.
Yeah, that was probably a bad example on my part.
Right, or use a
Right.
defibrillator or perform CPR, et cetera. Like, all of those things are within the rules that a naturopathic medical assistant is allowed to perform, so.
Perfect, good.
All right. Rebecca, I just wanted to check in. When are we planning to have lunch? Just want to figure out when we should take a bathroom break.
So Raquel just went to pick it up, so when she gets back, we can go ahead and break for our lunch, because it looks like we're really ahead of schedule right now.
Wonderful. So is everyone okay with waiting until lunch
Yeah.
comes back for a bathroom break?
Yeah.
Great, all right.
Yeah, because these are updates.
I thought you said enduring updates.
All right, so are we starting with our first committee update? So I have to go back to the table of contents to figure out which committee that is.
Minor office procedure.
Wonderful. Who's the chair of the minor office procedure committee?
I am.
Dr. Davidson.
Wonderful. Do you have your update for us?
Well, I have an informal update. We're still waiting for the minutes to come through, so that will make more of a formal summary, right? So based on my minutes, I can give an informal update. Is that satisfactory?
At this point, we're just looking for an informal update because the specific recommendations are going to be in a future meeting.
Yes, of course, yes. All right, so basically, we met and focused our discussion on getting a handle on the current picture of education and training for naturopathic doctors, and the findings from the previous report about the minor office procedures currently practiced by licensed NDs in the field, and thought about that in comparison with the laws from other states, so that we could get a sense of whether there's a gap. And then we have some follow-up information that we're looking to evaluate. Rebecca provided us with some initial information. So, for example, 8 states, if I've got this correct, have full authority, have given naturopathic doctors full authority for minor office procedures. And we wanted to get some more specifics about exactly what that really includes, so that we can compare the specific minor office procedures that are actually included in those states, and then compare them to the specifics of the training program, so that we can be able to show that there's a relationship there. And the objective really will be to continue to do this evaluation, so that we understand the relationship between the core competencies from the naturopathic doctor training and the currently allowed minor office procedures that are done in other states, so that we can try to bring some of that into the legislation here in California. We also talked about the idea of recommending to the full committee consideration of discussion of the concept of the issue related to coverage by insurance of these kinds of practices by naturopathic doctors, and that so I think that's probably as far as I want to go right now with my summary. So we're looking to look more specifically at the details of the minor office, like, well, what is the list of minor office procedures? How does that compare with what's been granted in other states, and how does that compare with the training programs?
Thank you. And just so that everybody's aware, the next meeting for the minor office procedure subcommittee is scheduled for June the 18th.
I'm sorry, we also talked about the relationship with malpractice insurance coverage, and what the current malpractice providers cover.
I wanted to say that I think we should put the insurance coverage issue on agenda for a future meeting, because that's something we haven't discussed in a while, and I think is a huge consumer access issue.
Perfect.
Rebecca, I was wondering if you remember a conversation about the issue of injecting anesthetic like lidocaine for doing something like a suture We had some concern about once you're injecting lidocaine, then it's considered a drug, is that correct? Do we need to have a physician's protocol, basically, to be able to inject? Yeah.
Yes.
Yeah, so that's,
And that would be something that you guys would have to put in a formulary and. so
yeah, I
that-
just think the subcommittee should be aware of that issue that we have, which is, we would have to have a physician protocol in order to be able to inject the anesthetic to then be able to do the procedure.
Correct.
It's all connected.
So may I ask a follow-up question to that? So am I understanding correctly that an injection is considered to be a minor office procedure in and of itself, or this
No.
is supplementary to being able to do a procedure?
It has to do with, since it's a substance that's being injected,
I think that's for the formulary committee.
yeah, it's kind of
that
complicated,
part,
but it-
Yeah.
yeah,
Yeah,
it's kind of a complicated issue around injectables.
It doesn't have any, it's separate from the procedure.
IVs, which is a
Yeah,
little confusing.
currently IM, IV, and sub-Q injections are within the scope of naturopathic doctors without any amendments or changes in regulation.
If you had a way of safely performing an office procedure without, and comfortably without lidocaine, you could do that, if we were allowed to do minor office procedures. They're not connected together. Yeah.
Okay, thanks.
All right. Is the formulary subcommittee ready to give their report?
Sure, also informal. So we met on May 9th. It was Peter Koshland, the pharmacist, as well as Dr. Thomas Quinn and myself. And we pretty much used the time to get an update from Rebecca regarding what has been done previously regarding the formulary. So it looks like from 2007, it was recommended to have an inclusionary formulary, whereas in 2015, they decided that it would be much preferable to do an exclusionary formulary to make sure that for the future, it would be easier to accommodate for newer drugs that came in. We requested more information from Rebecca, more so on the training as well as examination of pharmaceuticals within the current program at the naturopathic schools. And on top of that, we discussed the MD supervision, whether or not that we need to implement any residency requirements or a certification or additional training on pharmaceutical as part of our recommendations. And so that is going to be based a little bit more on our information that we get from the training and the examination.
Thank you. Any other questions or comments on that? All right. Then I'm going to move forward with the injection and IV therapy subcommittee report, as I'm the chair of that subcommittee. So we met, I'm sorry, Rebecca, was it the 5th or the 6th of May? Sorry, the 6th of May. And that was myself, Dr. Vera Singleton, and Dr. Virginia Osborne. And there are two major focuses of this subcommittee because, as I said, IV, IM, and sub-Q administration is currently legal for naturopathic doctors in California, so that's not really what we're working on here. What we're working on are updating our regulations to ensure consumer safety, making sure that our licensees have appropriate training for the procedures they're doing, and also that they have safety protocols in place in office in the event of an emergency or some sort of medical issue should occur. And so we talked about several issues related to safety, and then we talked about several different types of injection therapies and what sort of extra training may be required in those scenarios in order for naturopathic doctors to be able to do them. or what we would like to require. So the first thing we talked about was what we need for safety in the office, and we're currently working on figuring out an appropriate ratio of patients to staff. So if you have one person getting an IV, how many people need to physically be in the office? And if you have 10 people getting IVs, how many people need to physically be in the office? We don't have that ratio finalized yet, but we did decide that if anyone is getting an IV, we do need to have 2 CPR-trained people on site. Those people don't need to be medical, but that we would recommend that there be at least, of course, a doctor present and then one of their staff that is CPR certified. We talked about some just basic things about the office space, having appropriate access to restrooms, having the office space be adequate for safe administration, having the appropriate equipment and devices to perform the procedures, access for people with disabilities, and also making sure that appropriate informed consent is given to each patient prior to administration of any injection therapies. We talked a lot about the education, and currently in California, in order to be able to perform IV therapy, you do need to have had one of the specific IV therapy training courses, which are already, they're in regulation, correct, Rebecca?
Yes.
Yeah. So we have those trainings already specified, and there's the schools, Bastyr and NUNM offer those, and then also we have one approved outside provider. One of the things we're talking about is whether or not we want to have any sort of recertification for that. In that, if you got the initial basic certification, after some period of time, would a more abbreviated recertification be necessary? And that's something that we're working on. And then I'll talk a little bit more about some of the advanced training at the end of our summary, because we talked about that in a lot of detail. One of the things that we want to be sure that everyone is doing with injection therapies is using appropriate OSHA standards and appropriate sterile technique. I don't think we need to recreate those. I think those are in place, and we just need to be sure that our licensees know that if they're not practicing sterile technique and they're not following OSHA standards, that they're practicing outside of their scope, basically. And then there's also some new regulation regarding the mixing of IV therapy that is part of the compounding regulation. And again, that's not a regulation that we need to spell out or recreate. We just need to make sure that our licensees know that they need to be practicing within that. We are trying to decide whether we're going to require ACLS certification by our doctors giving injection therapies. It's not a particularly expensive or time-consuming training, and I think something that would benefit the consumers to have the doctors who are administering injection therapies be ACLS certified, so that's one of the things we're discussing.
Can you say what ACLS stands for?
Advanced Cardiac Life Support. It's above first aid and CPR, basically.
Is that different than BLS for healthcare providers?
Yes, it is. We also are specifying exactly what emergency medicine supplies need to be in an IV therapy suite for consumer safety. Again, this hasn't been finalized, but there's an abbreviated list here. We've made references like everything needs to be in date. You got to have someone checking every month to make sure your epinephrine hasn't expired, for example. Epinephrine, diphenhydramine, dextrose, calcium, a defibrillator, and oxygen are what we've come up with so far as emergency medicine supplies. Of course, you have to have the appropriate training to know how to use them. The next section, Section E, is basically we've covered all of that as far as the compounding regulations and the OSHA standards. We probably need to put something in here about biohazard disposal, just again, it seems obvious, but it is not going to hurt to spell it out to our licensees that they need to have a contract with a biohazard company for disposal of their biohazard and sharps and expired medication as well. And then we also just put a note in here about making sure that everyone who is performing any injection therapies is practicing within their scope. So, for example, earlier we mentioned that naturopathic assistants can do sub-Q and IM injections, and that's within the scope of that. However, they are not allowed to actually mix IVs, so we need to make sure everyone's doing the appropriately practicing within their scope. It's another, kind of goes back to the nurse supervision would be excellent in this scenario. Did you have something you wanted to say, Rebecca?
Yeah, that's why I have a lot of people calling and asking if they can use a nurse as a naturopathic assistant, because then they could start and stop IVs. They can't.
Right.
They can't.
That doesn't work. So there are these things that come up which are, sort of logistical nightmare, by the way, that our law is currently written, and part of why we're working on all of these is to even that out just so things flow in an appropriate and safe manner. Any questions about that before I move on to the section regarding training for specialty therapies?
I have a question, or maybe a comment. Just because we have a lot of moving parts here, and some things may go through and some things may not go through, diphenhydramine, which is Benadryl, is a very important drug to have in your office for emergency procedures, which naturopathic doctors currently, without an MD supervision agreement, can give nutritive IVs with all the rest of these regulations being met. And they can give epinephrine, but they cannot give diphenhydramine. So depending on what happens with the formulary committee, we may want to push Benadryl through as a separate single drug expansion with this or something, because it is so important to patient safety in the context of things we're already allowed to do. So I just want to put a special emphasis on that drug because of its usefulness for, allergic reactions and so forth.
Thank you. I think that's really important. I think it would be unfortunate to have to ask our patients to bring their Benadryl with them.
And I'll take a closer look at our statute, because I think if it's similar or the same as an over-the-counter, isn't it? I think you guys are allowed to.
It's IV.
Oh, IV, yeah, that might be a little bit different. Okay, so I'll take a look, but it may need to be specified in regulation, yeah.
Yeah, even compounded nasal. I mean, there's really, unless you just had them bring in capsules, but they don't work fast enough. Yeah.
And once you start compounding, it's a whole different beast anyway, so yeah.
I'm
Right,
sorry.
and I think this is an important thing you bring up, Rebecca, from a consumer safety standpoint, because in the case of an allergic reaction, the side effects of diphenhydramine are so much less severe than those of epinephrine that if you have the ability to use that first, you always want to.
Yeah, and I can't see that if epinephrine was okay, why a Benadryl wouldn't. So, yeah, that's something we can definitely talk more about in the formulary, sure.
Absolutely.
I have a question, please. Thank you. So in terms of strategy and thinking ahead, I guess my understanding of some of the work that you're doing and describing with regard to the patient safety aspects may be related to the case that was very prominent a couple of years ago with the intravenous administration of curcumin? Curcumin, yeah. Anticipating that might be something that would be used as an example, negative example, are you thinking about how the recommendations that you're considering would have, if they were in place, they would have prevented that bad outcome from happening, possibly?
We're unfortunately not privy to the exact details of that case at this time. However, in looking at these regulations, we're trying to look at all scenarios and optimize patient safety because we want to prevent things in the future, for sure. So certainly looking at the risks associated with all sorts of specialty injections are definitely being considered.
Wasn't that a compounding error? We don't know.
But we're not going to talk about any kind of enforcement cases right
Yeah.
now without, yeah.
So I didn't know that that was a current enforcement case still.
So on our side, it's been closed, but apparently there's still some litigation going.
Gotcha.
I don't know if it's civilly or what, but it's, yeah, so.
But I guess we can, maybe we can say things like, in cases like these, here's a list of the considerations that might be important to try to avoid negative outcomes. kind of
Right,
thing.
yeah, due to an adverse reaction that may occur, these are the things that we want in place. So yeah, absolutely, I absolutely agree with you.
Yes, and I would say that that's absolutely the perspective that we're coming from. I mean, as a doctor who performs IV therapy, I would say that, there's rarely a negative reaction. However, as doctors, we always have to consider the very worst case scenario in order to protect the consumers. And so that's definitely the perspective that we're coming from. I mean, the thing you want is to throw out your epinephrine expired and unopened. So.
Thank you.
All right, any other questions before I move on to the section on training and certification? Great. So we really talked about the training and certification of doctors who are performing IV therapy and other injection therapies. And as we said, for basic IV therapy, that training is in place and is agreed upon. And the only thing that is something that we're considering is whether or not there should be recertification at any particular time. Within a particular time period, like every 5 years, you need to take an update class or something like that. There's a section here on continuing education, basically talking about what is included or what should be included in continuing education. And you guys can read that on your own. It's pretty basic stuff as far as how to mix different substances and dosing and infusion times. And basically just says, you need to know the substance that you're infusing and know how to use it safely, otherwise don't use it. So, you need to know basic things like calculating drip rate, et cetera. Then there was a question about some of the advanced substances, and we've spent quite a bit of time talking about this and what we need to do in order to, number one, address several injection therapies that keep coming to the committee over and over again. And number two, allow for the use of new substances without having to create new regulations every time a new substance comes onto the market. So to have something in place so that as new therapies or new substances which are injection-based come onto the market, we have some criteria by which we say our licensees need to be trained in order to safely use those. And I think this can actually be divided into two separate sections. And I didn't think about this at first, but it really came to this when speaking to experts in these fields. And the first thing is that you need to really clearly know your route of administration. So so a perfect example of this is microneedling. Is everyone aware of what that is? Okay. So microneedling is a process by which it's called a pen, administers teeny tiny sub-Q injections over the surface of the skin. It's often used on the face, although it can be used other places, in order to drive some sort of substance or medication into the subcutaneous tissue. So this is clearly within our scope because it's a subcutaneous injection. However, it's a specialized way of giving a subcutaneous injection, so I don't think we can say, okay, because you took the basic injection therapy training and you know how to give, a sub-Q shot, that you can then go and do microneedling without training. Like, you clearly need to be trained how to use this particular device. So we need, I think when we look at advanced training, we need to look at making sure people are trained on their routes of administration appropriately, and then making sure that they're trained in the substance which they're injecting. And the nice thing about dividing it up that way is that routes of administration has to be some level of hands-on training. You know, you can't say like, oh, watch a video on how to insert a catheter. Someone has to actually teach you, and then they have to make sure that you know how to do it, you know. Whereas when we're talking about new substances, that's something that can easily be done in a lecture format, even a webinar, allowing for greater access. So I think that it's important for us, and we're working on how to figure that out, how to divide that. And so then the question becomes, you know, what sort of training are we going to require? And that's sort of the nuts and bolts, one of the big things that we're going to be working on prior to the next meeting, because I think the safety stuff is pretty well hashed out at this point, with just a few details that we need to work on. So we talked about a couple different specialty agents. We talked about intravenous chelation, which is something that we already do have some certification courses available, and we want to specify those. We talked about PRP, which is plasma-rich protein, platelet-rich plasma. And we talked about microneedling, specifically ozone injection therapies, biological allografts or stem cells, and other new agents or admixtures as they're become available in the human market. So we're looking at both, are there classes available that we're comfortable with specifying? And do we want to allow for some sort of apprenticeship training for certain sorts of procedures or injections which there isn't like a specific structured class that we can refer to that we want our licensees to do? So if there's a specialty type of injection therapy, it looks safe and beneficial, is there a scenario in which we can say you can train with someone who has X number of years of experience for X number of hours and then be able to perform this? And I think that would be helpful in incorporating some of the newer therapies as they come onto the market. So that's where we're at with that. Does anyone have any questions about that?
Oh, yes.
Great.
I have several questions. So I find myself asking, you know, our statute, as I understand it right now, allows a practitioner to use within our scope whatever means and methods we have been trained to do. So that is, if you can show that you've been trained in something, that you have expertise, then you can use it, as long as it doesn't fall, you know, outside the things that we definitely can't do. So many of us definitely learned chelation therapy IV in school. I don't know if that's at every school, but I thought it was. I don't know. No? Many of us learned ozone therapy in school, actually. No, didn't learn that either. So I guess I want to put a word in for being pretty flexible. And the other thought that I had is maybe there's a way to do this through the approvers of continuing education to say, if you're going to offer, you know, to be acceptable, maybe they would tailor it anyway. Once we make a regulation, you need to, you know, ozone therapy needs to be at least 12 hours and cover these areas, then they're going to tailor the training to that. But there's going to be some interplay there with the CE providers, you know? So that's part of it. And then having some category, exosomes is like the new thing. Have you heard of this yet? But there's all kinds of self-body derived hyper-concentrated extracts of yourself that are being injected and put in IV that can apparently have miraculous effects. We'll see. But I have patients that are going to Nevada, for example, to have this done. That we want to have some like you already said, kind of inclusive category of and other things as they emerge.
Well, absolutely. We did want to make sure that we don't write the regulations such that new therapies are being prohibited in some way. Regarding the training in school, I think that if we set forth certain criteria as far as numbers of hours of training, et cetera, that should actually take into consideration what people learned in school and what they learned outside of school. And certainly, as we did with the basic IV therapy training, if there's something that's common enough, like chelation therapy, we might be able to go to the schools, look at their programs, and decide whether or not those programs meet our criteria.
Right, and so if we could get the schools to understand that, the schools could either A, provide a certificate that would qualify for California's new regulation, or meet the requirements of the number of hours instead of a certificate, just to kind of give people options depending on where they went and so forth.
Sure. So I can give you a little bit of insight on that. Currently, Bastyr is the only school that has even made an effort to try to become an IV therapy provider. So their course that there's 2 courses that you'd have to take, minor office procedures and then the IV therapy, compounding, safety, and whatever it is. So you have to take those 2 courses and you're automatically certified for IV therapy here in California. Or you can take one of the classes with Dr. Osborne, and depending on which course you take there, could also qualify you to meet those requirements here in California.
So I went to school in Arizona, and it was a long time ago now.
They have an IV therapy course, but they have not sent in any of the information to us to become a provider. We have not
I see, since
seen
our
any
regulations. Because I was going to say, we were trained by Dr. Osborne, and we had multiple minor office procedure
Sure.
classes. So they just need to qualify.
They
They
would
just need
need
to
to
line
qualify.
everything up.
At this point, they would need to send us a curriculum of their courses. I mean, we can reach out to them, but it really is up to the schools to provide us with their curriculum to make sure that it meets our requirements within statute. If it does, then we can go ahead and approve those courses. And if the student took those while they were still in school, once they come out, as long as it's on their transcript, we'll give them credit as a certifier.
I think it would be great, and this is a different issue, if we could send a letter to the schools once every few years, just to let them know they have this option, and then it's up to them. But it may not be on their list of priorities, just because they're not thinking about it. But I would like, and certainly some of their graduates do come and practice in California. I'd like to send them a letter and just say, you have this opportunity, it's going to add value to the education that you're providing your students.
I feel like we should send the letter to the student organization.
Good point.
Did that address all of your questions,
Um,
Greta?
I suppose we'll have more discussion as things get ironed out. It is a lot to cover, all of this.
It's a lot of information, and I have been definitely speaking to experts in the fields to try and get some more specific criteria in these areas. And one of the last thing that I would mention regarding training is one of the options that came up, because several of these therapies probably don't cover an entire weekend worth of training, about doing some sort of, having someone put some sort of an advanced injection therapies training together that covered 3 or 4 of them.
Oh.
Is something that might be helpful for our licensees, because it seems like, in my experience of what licensees do, once you start doing more advanced injection therapies, you usually want to do more than one, because you kind of have the setup for it.
Yep.
Yeah.
The other thing was that, for example, microneedling is sub-Q. PRP can be IV, but it can also be intra-articular, or it can be sub-Q. I mean, it can be administered in many different ways. And it isn't technically really outside of our scope currently. And I don't know how much we need to regulate on things if they're already covered.
Well, I think that, yes, that goes back to my original talk about people. I mean, we're basically just saying that you need to be appropriately trained. I don't think that it's,
Yeah.
an excess burden to our licensees to say, if you're doing PRP, you better be using sterile technique. I think it's a good reminder so they don't end up on our enforcement docket.
Yeah.
And just as a reminder to everybody, I know the other two subcommittees are making recommendations to change statute. We already have the authority in our statute. These are for regulations, so this is regulatory changes only. So this is definitely where you get specific and really clarify for the licensees.
I'd like to make one comment. First of all, I'd like to say, really good job on laying out the whole subject and moving us forward, which is great. I'm wondering about safety qualifications or how we qualify, like the new therapies. Are we going to write in there some kind of way to determine what's going to be considered a safe therapy? Because if something's coming out as a new type of therapy and hasn't been thoroughly tested, what do we use? The FDA? Do we use, which?
That is actually one of the things we're still working on, because
Okay.
I think that's one of those gray areas, and we want to first and foremost protect the consumers, but also protect the consumers by allowing them to receive these therapies from licensed medical professionals. So one of the things that we're seeing is unlicensed practitioners doing things like microneedling, which seems like such a bad idea to me. So we're trying to figure out how to put into regulation appropriate safe access to these therapies while not just giving sort of a blanket, approval. And I think that that's something that we're still working on. It's an excellent question.
I'm sorry, could I ask a clarifying question, just to make sure I'm understanding that discussion, which I thought was very
Sure.
helpful? Was that question and the discussion specifically relevant to a distinction between the techniques and the substances?
I believed that Dr. Weisswasser's comment was on the substances. So as new substances become available, how do we determine that that is actually an appropriate and safe thing to use?
And so then the focus of that particular interchange was about how to determine that substances are safe and effective. Is that fair to
Correct,
say?
yes.
And I thought Dr. Weisswasser mentioned the FDA. So is it normal? I'm just asking this, I guess, for my own edification and being informed about it. So are there a variety of ways in which the substances used for treatment by naturopathic doctors are determined to be safe and effective, and the FDA is one of them?
I think that there's going to be some treatments that are going to be done that have not moved through the FDA yet. And so we may need some lesser body or way to determine if something qualifies as a safe medicine. I guess that's kind of what I was thinking.
That's a different thing than actually being trained in the use of a particular substance.
Sure.
So that's actually three things,
Sure.
which I did not realize we were in the business of determining what's safe as a medicine. That's not really our purview.
It's definitely, it is within your purview, as the, what is appropriate, correct? And we can definitely take note of what the FDA is putting out. There have been plenty of reports from FDA sending things to all of the boards on what's safe and appropriate. I know right now stem cells are a big issue with FDA because there are practitioners out there, not NDs necessarily, but there are practitioners out there that are not using stem cells in an appropriate manner. They're not using FDA-approved stem cells, and they're getting them from wherever. There was a case several years ago where somebody was using pig stem cells. So we do have to be careful, but as the committee and subcommittee that's working on this, you can definitely look to the FDA to get feedback on appropriateness. If you choose to do that, it'd probably be helpful moving forward.
There's a tie-in here with the minor office procedure committee as well, in that some of the substances used for advanced orthopedic applications are fat and bone marrow. And those require a very small liposuction-like procedure in order to obtain the fat cells from the person into which they're going to be injected, or actually a bone marrow withdrawal from bone, which is really a surgical procedure. Yeah. And so that's all considered part of this orthopedic realm of injection therapies that's happening and emerging and growing very quickly. So we'll just have to, as we, consider both of these, we may want to provide for that or not in the minor office procedure side of things as well. What's appropriate and not for naturopathic doctors to do.
Sure. And the subcommittees, just so you're aware, even after the recommendations have been made to the full committee on these issues, the two subcommittees, formulary and minor office procedures both, can still come and meet time to time to review new techniques, new technologies, new drugs, and would probably want to do that at least every 2 years, if not yearly, just to make sure that we are current. But that is absolutely appropriate.
And because they are legislative in nature, not regulatory at the moment, we need to language the legislative part open enough to allow us to continue to make regulations as we go forward.
Correct, yes.
Absolutely. And I just want to say that this mirrors very much what we're talking about whether or not we need recertification or retraining for our licensees. One of the therapies that came up with this is chelation therapy, and how important it is to get sort of a refresher course or a recertification course at least every 5 years, since the therapies itself change so significantly in that period of time. And so if people are doing it, they need to make sure that they're going to, and in this, like I said, we actually have providers, going to a provider and having their appropriate update in order to continue the therapy. Any other questions? Looks like our lunch is here.
Want to go ahead and take a lunch break?
Yeah, I think we should, at this point, we should break for lunch. This is a good stopping point. And then when should we meet back up?
Do you guys want to break for a half or an hour? It's up to you.
12:30 gives us 42 minutes.
Great, I love it. We'll reconvene at 12:30.
All right, perfect. Thank you.
Are we good to go back there? Thank you. Yeah, we have no remote sites today, and we only have a few more items, actually, on our agenda. So I think we need to do another roll call, correct?
Yep.
Do you want to do that, or should I?
Okay, I'm going to go ahead and call a roll call. Dr. Weisswasser?
Here.
Hey. Dr. Davidson?
Here.
Dr. Quinn?
Here.
Dr. Yoon?
Here.
Ms. Swirls? Here. Dr. Thompson?
Here.
Dr. Singleton?
Here.
And Dr. D'Amico?
Here.
All right, great.
All right, at this point, we're going to get an update on the California Naturopathic Doctors Association from our Executive Officer, Rebecca.
Perfect, thank you. So CNDA appreciates us being able to give an update for them. They were not able to fly out for a 3-minute update today, but I told them I would be more than happy to give it to you guys. So there's two things that they have questions about, and it comes up often, I guess, from their licensees. So these are two things that maybe these subcommittees can take a look at. One is the use of lactulose, prescribing lactulose. I guess a lot of vendies are needing to use this, and from my understanding, it's something like a sugar or something, but because it's a prescription only, it may be something you guys are not allowed to use in the current scope. So this is something that maybe you guys can, in the formulary subcommittee, can kind of talk about. And then another thing is that they're trying to get some information on hemp-derived CBD, since it's now legal. They want to know whether the NDs can use hemp-derived CBD products. There's like lotions and different stuff. I know that you can go on to the website right now and buy hair products that have hemp in it. My daughter has a conditioner that has hemp in it. So those are the two questions that they wanted to bring to the committee to see if there can be a little bit of clarification on the second one, and to see if that's something that we can add to the formulary for the lactulose. Was there any questions on that?
I was just going to say, there's hemp that's used, like hemp oil and hemp seeds and hemp protein. And then there's an extract of a particular chemical called, CBD, which has a medicinal effect. And then, of course, there's flour, which also has the THC in it, which is
Right.
out for us. But it seems like the concern is around CBD.
Correct. It is the CBD that does not have any THC in it. And for the most part, I believe that the law, and I have to look at it because I haven't looked at it in a minute, but I think that it is hemp-derived CBD is what is kind of out there on that consumer market.
Was this a law from the state that was passed?
Yes, so I believe, wasn't that a federal level? And the state had already taken an action that based on the change of federal law, that the state would go ahead and enact its law. So because the Fed went ahead and took their, I guess, their option of hemp-derived CBD being okay, without any kind of recommendation, that the state of California took the basis of it is legal to use here.
Have you guys seen
Because-
that?
I have not read the,
Do you guys get it?
full-
Could you send it to us so we can just, so we know what we're talking
On
about
the
as far as
CBD, mhm.
legality?
Oh, is that the one you sent me?
yep, that one.
Yeah, and we definitely have it. And we
Just so
can,
we can see, because otherwise we don't really know what we're saying is.
right, and we can add that to materials for the appropriate subcommittee, and then we can also add that as a potential future agenda item, unless, of course, it's linked to another subcommittee update.
Okay, thank you.
Thanks. Okay, so we just added that to my list. Okay, and the next thing that they just wanted me to go ahead and let you guys know about is the save the date for their next conference, which is the New Frontiers in Naturopathic Medicine. They're going to bring kind of some of the newer stuff that's kind of up and coming. And that is going to be February 29th through March 1st, 2020. So if anybody is, Doubletree Palm Springs. So apparently Palm Springs was a hit. I did not get to make it this year, but I heard it was a really great conference. So if any of you guys can make it, I'm sure I'll be there to give an update.
What are the dates again?
That was February 29th through March 1st, 2020.
Regarding these other previous two items, was it not a legal opinion that we received that said we cannot discuss, prescribe, or otherwise provide information about CBDs? And does that still hold?
That was prior the law being effective for CBD. The recommendation for medical marijuana is a little bit different.
Yes.
In that it's not hemp-derived, so it's the actual flower, right? So I think there's a little bit of difference there, and that's why I think we're trying to get some clarification on the hemp-derived CBD or just using the CBD, because there's a lot of apparent medical properties that is good.
Can we go forward with positive vision and confidence and just say, look, this, we have in our law the ability to use natural substances to heal. This is a natural substance. It's not categorized in any shape or form as a drug in the state of California.
And I think that's what
Exception.
I think that's what we're waiting legal opinion on.
Right. So I would suggest putting this either to one of your subcommittees and/or another future agenda item. We'll circle back and get all the recommendations, because I know the medical board has recommendations also that I know Ostia was looking at as well.
So can we get a refresh on legal opinion and all that
Absolutely.
info by next meeting?
Yep. And we'll provide it to subcommittee materials also that are relevant for
And the
each
same
subcommittee.
thing would be for, as an example, we can prescribe natural substances and hormones, without doctor's protocol agreement.
Correct.
And so, for example, we could prescribe Armour Thyroid, which is a prescription item, even though you can actually buy thyroid off the shelf that is not a prescription item.
Sure.
Okay? So lactulose is just a milk sugar. It's a food substance. It's used for testing of gut functionality. You take a bunch of it, and then you do breath tests to see if
Correct.
you're digesting well or not, et cetera. And that's another thing that it's under the same idea. I'd like us to be able to just say, in our current interpretation of our law, this is not a problem, even though it's technically a prescription item. The law was not based on whether something was a prescription item. The law was based on what the substance was, except for certain things.
Correct.
Right.
But it's the way that the law was written, and it says something to the effect, and I'd have to pull up the actual law, but it says something to the effect of if it can be purchased over the counter without a prescription and is the exact same, then it can be used and administered or prescribed by an ND. So I think we really have to look at that law, and then the formulary subcommittee would have to reconvene once a year and just to kind of look over and make sure that there's nothing else. But like something like this that is used for a breath test, and it is a sugar type of product, I think that this is something that you could ask to see if they'd put it in. But if you're going to go and ask for a broadening of the scope in terms of prescribing rates anyway, probably want to do it at the same time. But yeah, it sounds like something that's going to have to be done within that formulary.
Lactulose is sold as a laxative,
Also,
but
yeah.
I'm trying to see if you can buy it over the counter, but I think it is usually prescription.
Yeah.
Yeah.
Yep. And that, I think, is what,
But so is magnesium.
yeah.
So we'll go ahead and add those to your future agenda items as well as the appropriate subcommittees, and we'll get you those recommendations and information for your materials.
All right. And now we're going to review and approve our minutes from our March 5th meeting. Did everyone have a chance to read over these? And did anyone have any corrections they wanted to make? Hearing no objections, I would move to approve the meetings from our March 5th, 2019. The minutes from our March 5th, 2019 meeting.
Second.
I'm sorry, who gave me the second?
Shirley.
Thank you so much. All right, I'm going to do a roll. Sorry. I'm going to do a roll call vote. We had a motion from Thompson, second Shirley Worrells, and roll call vote, Dr. Weisswasser,
Aye.
Dr. Davidson,
Aye.
Dr. Quinn.
I did not attend, so
You can still vote on it if you like to. Dr. Yoon, thank you. Ms. Worrells,
Aye.
thank you. Dr. Thompson,
Aye.
Dr. Singleton,
Aye.
and Dr. D'Amico.
Aye.
Great, we've got 8 yeses and that moves.
Wonderful. At this point, we're going to talk about future meeting dates and locations. Do we have our next meeting scheduled, Rebecca?
Which
Well,
meeting?
we have our strategic plan meeting
Yes.
scheduled. Do we have our next general committee meeting
No,
scheduled?
so that's what we're trying to come up with a date now, was for the third and hopefully fourth quarter, but if not, at least the third quarter meeting. I know that we've got two of the subcommittees are meeting in July, one is meeting in June, and then we have the July meeting for the for the strategic plan session. So we may want to look at a a time when the subcommittees have been able to re-meet. And then that way they may have some more material that they can bring back. They may not be ready for the recommendations, but they may have some more updates or maybe need some feedback from the committee.
So,
We'll be looking at,
so I mean, there's the doing it at the end of summer option, and then there, because September can be a mess if you have children.
it can be here, right? So what we're looking at for the third quarter would probably be a fall date, and then the fourth quarter would be a winter date, preferably before the end of December.
I just wanted to check, Dr. Quinn, are you in Southern California or Northern California?
Northern California.
Okay, so we have 3 members from Southern or 2?
We have currently three members from SoCal, and the rest are from North.
I just keep thinking if we could find a space near LAX or, someplace that's not far for them to drive.
Yeah, the only thing that we could do is get Bastyr, but that's San Diego, and then they're just as easy to come to Sacramento than it is, I mean, it's just as easy
I
to
met
come to
somebody who's
Sacramento
on the
as it is
Santa
San
Monica City Council the other night, but then it was a wedding, so I didn't get a chance to circle back around and say, hey, have you got chambers we could use for a meeting?
So we can definitely take a look and see if there's something around the LAX so that if we do have it down there, it's easy for all of the NorCal people to get there and get to the meeting place. But it's definitely up to you. I'd like to remind everybody to keep finances in their head when making these decisions. It costs roughly, depending on if we're going down the same day, it's about $500, $450 for a plane ticket for everybody, round trip. And then if you're staying overnight, it's about $110 in that area per night. So, and then per diems. So just keep that in mind.
If we have to, we can always schedule later start time, so you don't have to stay the night before.
So we're not
That is
required,
correct,
we're not
yes.
required to do this, but we just want to make sure we're being fair to people who
And
are traveling
we've
all
done
the
before
time.
is we've had a teleconference site down there also, so there is a site for someone to go from the public, and that way, that saves money also, and we can have a Southern California board member attend down there.
Yeah.
Well, speaking as a Southern California board member, I don't feel slighted if the meetings are up here.
And
Well,
I
that's always
second
great.
that. Yeah, it's-
Okay.
It's not an inconvenience at all.
Perfect.
Consider
Good.
teleconference.
Sure. And we do keep the travelers in mind, and that's why we don't start our meetings until 10 a.m. because SoCal Southwest usually gets people in around 8:30, 9:30. So in order to get them here on time, we start it at 10.
Great, so I think we've decided on Northern California location, because that works best for everyone.
Okay.
And then we just need to find sometimes if the subcommittees are meeting in June and July. I think we're looking at late August or September at the earliest
Yeah,
for
and I
meeting times.
think I would push it down because I'm going to be out for part of August. So
Are you thinking October would work better for you?
I would think at the I would say very, very last week of September, forward onto October.
Okay. And then if we meet in early October, we would then meet again in December or January? Is that the idea?
Probably December because January would be our annual meeting.
Okay.
Does everyone here have, I would say accepting patient days, because the meetings are almost always on days where I have a full day of patients, so you can't really use that as I mean, you can, but are there days like that are, like Wednesdays are never, ever going to work, for example? Are there days that are rule-outs for any of us?
So, yeah, I think we've asked this before and everybody has a different patient day that is one of their busiest.
Kid pickup days where I have to get my kids, so I have to be there to pick them up.
Okay,
What days are those?
So like the last meeting I had to leave early because I had to-
okay, right.
And that's Tuesdays, Thursday, Friday. So Monday and Wednesdays are best.
Okay. So normally what I try to do is send out a significant date collage. And we just kind of go based on the date that most of the people can make. And I have no problem sending out a Google if it's
But if we can
easier.
do it
But if we
now,
could do
really
it now,
fast.
that's
So I'm
perfect.
thinking like either the 23rd or 30th of September, being Monday.
Sorry, I just have to check the Jewish calendar.
Yes,
Rosh Hashanah?
September is, yeah.
yeah, it's a big month.
I know, I
Um,
work on.
We can move it to October if you guys want to start looking at October dates.
Well, there's only like specific.
Rosh Hashanah is on the 30th, so the 23rd should be clear, I believe.
Should be fine, yeah.
I will be out of town that time.
And I have an FNMAR meeting that day.
Okay, the 7th of October is a Monday. Yom Kippur is on Wednesday, the 9th. But there's nothing on the 7th that I can see.
Currently, I'm free on the 7th.
Yeah. that would
October
work.
7th?
Yeah.
Monday,
That's
October
fine, no
7th.
Commitments. So that was October 7th?
Mm-hmm.
That's sounding good.
For the third quarter meeting. And if you guys would like to take a look at December, maybe the first 2 weeks in December before it starts getting really hectic for the holidays.
Yeah, does anyone have travel plans in December?
Not yet. What about the 9th, which is a Monday?
I mean, personally, the last 2 weeks are easier because all our patients are gone, from my perspective, but.
Yeah, but then the 23rd is Hanukkah, 24th is Christmas, Kwanzaa's on the 26th, New Year's is the 31st. It gets to be where people leave,
True.
you know?
Yeah.
First call for the 9th,
What day of the week is that?
it's a Monday.
Monday.
Yeah, that's okay.
Okay.
Yeah. Well,
Okay.
that was easy. So I've got Monday, December 9th for the fourth quarter meeting.
And October 7th was
Mhm.
Yep, so third quarter meeting we set for Monday, 10/7, and the fourth quarter, Monday, 12/9. And I'll definitely send out reminders to everybody.
Pardon me. Great.
Perfect.
I don't believe that the subcommittee, some subformulary committee has a date yet.
So no, it's to be determined. I need to go and look and see. I think I was waiting on one other person to, reply on the doodle. So I will send a reminder back out to him to let me know when he's available.
I have a feeling we probably need another meeting as well, sometime scheduled.
Sure, yes. Because I think right now, the drug furnishing, I think what's looking most promising is a July, I want to say it was, I think the 16th or something. So I'll take a look and I'll send that out to you guys after I confirm with Dr. Spar if he's available that day as well, so.
Thank you.
Okay.
Great, that was wonderful. All right, so agenda items for future meetings, I had recommended that we speak about insurance coverage. That was one. I think
had
a
a-
couple others got brought up during the meeting.
CBD.
Yeah, CBDs,
Yep.
definitely.
And checking back with nursing.
Oh, and scope stuff.
And I had a question about the Affordable Health Care Act. Is that just like, is that just kind of disintegrating and blowing away in the breeze? Is that even on topic, given that we've never conformed to federal law?
It doesn't look like that's going to
Access.
happen anytime soon now that they're messing with the federal one. So, yeah, it was never, I don't think it was ever made. I don't think people were made to comply with it, or else NDs would be your guys' treatments would be all paid for by my insurance company, and I wouldn't have to come out of pocket. So,
The last we heard, like 5 years ago, it was just a matter of regulation by
Yeah,
the insurance.
because Aetna currently does pay for a lot of naturopathic treatments. I'm not sure if they're doing the office visit. Who?
United Healthcare.
United Healthcare. And Dignity Health just contacted us yesterday, as a matter of fact, to find out credentialing-wise, whether you guys, are credentialed and whether we do all this credentialing on you. So Dignity may be another one
When
that
you-
starts.
When you say they cover, do you
Cover.
mean in network, or do you mean as an out-of-network provider?
I'm not sure how they do it. I just know that they are covering some of the
Yeah,
treatments.
so does Blue
because they-
Cross, so do they all, a little bit, but they're
I
not
think
required
they're
to?
all starting to, and I think it's because when people are getting denied through their insurance company, they're going to the Department of Managed Health Care and filing a complaint. And I think that is the only way that these insurance companies are going to start getting told that they cannot deny a naturopathic treatment just because they don't know what a naturopathic doctor is. So I think the more that happens and the more these insurance companies are educated on the fact that they're not supposed to be denying them, it'll start becoming more norm. But until then, if you have a patient that is being denied something, just let them know to contact us, and we can give them the information on who they need to contact. Or you can just let them know to contact the Department of Public Health, Department of Managed Health,
So
and they'll assist.
is this something that you would like an update, maybe as a full committee from Rebecca next time, about maybe status of each? Is it?
I think we
how far-
kind of just got
Fair.
it.
Sorry?
I think we got it.
Okay. all right.
Basically,
I
that's
just-
the.
On that as well. I know for the Affordable Care Act, California is the only state that did a little bit of a different thing and put parts of that into a bill and segregated that. And one of the things that didn't pass in California was a discrimination law, which is why there was so much issues about whether or not we should be covered because we're licensed here.
And as to future agenda items, would you guys also like perhaps to see something on the website directing consumers with information on if they are denied? What to do?
Yeah.
Or questions about insurance, maybe? Is
sure.
that something
mean,
relevant for?
Yeah, because this is a perfect time to do it. We are actually working with Department of Consumer Affairs right now as we speak to upgrade and update the look and feel and the information that's on our website. So anything that you think would be helpful to consumers, this is one of them. We can definitely put our front-facing for the consumers.
Right, she can
And
put
I would
together frequently asked questions
Sure.
or something like that to
Yeah,
post.
and I would still like that update on a future meeting agenda.
Absolutely.
Yeah, just to make sure that we're totally clear on that, because I think this is a really significant consumer issue.
What's the
far as
timeline
access
of
to
the
care.
website update?
I'm not sure because of the, so there's an ADA issue going on right now where everything that's posted to our website, any document, has to be readable by a optics reader. So because of that, they are taking a lot of stuff down like really quickly, and then we can kind of take our time putting it back up. But they're trying to get in front of this July 1st date, which is the date that we're all supposed to be in compliance with this ADA Act. So I'm not sure how long it's going to take to actually have the whole thing put up, but we can definitely talk. It probably won't be before, well, it may be before the next date, but that's okay because I can come back out to you guys with
and
that.
maybe whatever, she can give you the update at the next meeting, including any kind of printout or any kind of, maybe what they've already finished.
Well, I'm
And then-
imagining at the strategic planning session, we're going to have a lot of ideas about what we want and what we don't want on the website.
Sure.
And if the new one's up, we can see what's on there, so we're not repeating ourselves.
Right.
If it's not, then we'll just say what we want, and it might be already there or maybe not.
Okay, so currently I have the CBD hemp issue. I've got the RXing of lactulose use, and I'm sure that that'll be put onto the subcommittee. Scope expansion, of course, I'm sure we'll talk about that next. Malpractice insurance, is that the insurance you guys were talking about, right? The
health insurance and malpractice, I think, are two different.
Yes, two different, correct.
But I think both of them.
Okay, perfect, yes. Because currently, the only time that an ND has to have malpractice is if they are a naturopathic corporation. And then it is you have to have malpractice insurance. Yeah, so I'm not sure why that wasn't thought out. But, so we also have the RN scope talk, and then insurance coverage.
LVN.
LVN, yeah. And then the website update.
And of course, all the subcommittee. Right.
Yeah, yep. So if there's anything else that we don't think of today, please shoot me an email, and I'll add it as well.
Do we have any other items to discuss today?
Is there any time frame on the website update at all?
You're saying maybe by July 1st, but.
So, okay, so they're going to pull the old one down by July 1st.
Okay.
And put a front-facing, just kind of a generic, kind of what we have on there right now, minus all of the documents, the old documents. And then they'll start kind of putting it to how we want it to see it. But yeah, July 1st, a lot of the stuff is going to be taken off of there.
Okay.
Yep.
And then for things to be put back up, this
Uh-huh.
is just a
Is-
rolling?
So, yeah, we'll kind of be working, the staff will be working with the Department of Consumer Affairs to kind of come up with the information and items that we're going to be putting back on there. A lot of the same stuff that we currently have on there now, we're going to have, but some of the stuff is really old and outdated.
Okay.
The consumer brochure is one of them, totally old. I think it's from 2009 or something, so yeah.
I just wondered if there's anything that we as a committee need to discuss that should be on the website, or will you guys?
So you guys are more than welcome to go and take a look at our website now and see what's there. And on the 25th, when we meet for the strategic plan, we're going to be discussing this stuff, especially front-facing information for consumers. So that'd be a great time to bring it up to us. And if you see anything offline, send me something, say, hey, and if you have the link, just send me the link of where it is on the website, because our website's pretty, very in-depth, so it depends on where you are, and there's like 3 different ways to get to certain things, so sometimes I may not be able to find it, but you'll run into it. So yeah, definitely send me the link if you can.
Okay.
And you, if you want something on the website, you have to send it somewhere and then they do it, right?
Yes.
Are there any other comments or questions?
I have a question. So I have some more general questions about naturopathic medicine as a practice. And I'm interested in understanding the context in which I can ask questions like this of individuals, as opposed to do we have to talk about it as a committee in order for me to be able to learn more about it?
Just for educational purposes, knowing what a licensee is
Well,
and does.
I can be more specific. I mean, the 2 basic questions that I have in my head are, what would be a good way to encapsulate the difference between naturopathic practice and allopathic practice? And that's number 1. And number 2 is, what are the ways in which the substances which are used for treatment by naturopathic doctors are determined to be safe and effective?
So,
So
Yeah.
is that something to talk about here, or can I just talk to any of
A little bit of
you
both.
separately? I don't want to break that rule that, you
Yeah,
know.
no, and that I think is just a little bit more education for you as a member in terms of, you're a public member, so yeah, knowing kind of more in depth of the practice and the medicine and everything behind it. Absolutely, you can definitely discuss that with one of the professional members of the committee, and you should be fine.
And if you're concerned at all, you could pick one of the naturopathic doctors here, if just as an example, and you can talk to one of us thoroughly about something. You just can't call multiple people.
Correct.
Correct.
So, yeah.
Okay, that's helpful.
But as long as it doesn't have to do with current committee business, it's not on an agenda somewhere, it's not like a project that we're doing together, that is all for the meeting. But anything else about the profession in general, interest, knowledge, law, is all available to the public,
And you can always call Rebecca too after you talk to a licensee, because then you can get the board side of it as well.
I'm sorry, I didn't hear all those words that you just said.
Oh, I recommended, maybe after you talk to a licensee, getting some information, you can always contact the board directly, getting the board side of
I see.
the information
Yes.
that you require also, or that you
Great.
still have questions about.
Thank you.
That was a great question, thank you.
So at this point, I'm going to adjourn our meeting and look forward to seeing you all in October. Wait, no, for the July. For our strategic
Listen to
plan.
Dara.
Yeah, for our strategic plan meeting. Drive carefully, everyone.
Thank you.